Today we end our Best Me month-long series. If you're looking for a long-term solution to the physical change of aging, it could be as easy as going to Madison Avenue and meeting with Dr. Jame Heskett at the WellPath facility. She's already shown us how to get rid of dark circles. Now she's showing us how to get rid of stretch marks with a quick and easy treatment called Carboxy. Hi, Dr. Heskett.
Hi, nice to meet you.
Thanks for coming. So tell us a little bit about Carboxy again. What exactly is the procedure?
So Carboxy therapy is the injection of CO2 gas directly underneath the skin in the area you want to increase circulation or generate tissue repair. And so what we're doing today is the stretch mark, and the stretch mark is an area of damage to the skin that has stopped healing. So once we inject the CO2 right underneath the stretch mark, it will start to regenerate that tissue again by increasing the flow of oxygen, the delivery of nutrients, and setting forth that repair system again.
Okay, and we have Courtney here today. Hi, Courtney.
Hi.
So tell me a little bit about your concerns with stretch marks.
Yes, I have stretch marks on my arms. It's white, so it doesn't really go away. It's hard to cover, especially when you get a tan, because then you just have the stripy look. So.
Have you ever tried, I know there's a lot of creams and ointments to go. Have you ever tried any of that?
I've tried the oils, I've tried the creams. Nothing seems to really work.
Okay. And Dr. Heskett, can you speak to that? Why don't those creams do much?
Well, it's because the skin underneath the stretch mark is dead, and nothing is going to work on something that's dead. It's only going to work on something that is healthy, and so that's why it stops repairing and stops getting smaller. So if we can start that process going again, that repair process, then you'll get a shrinking of the stretch mark, a filling in of the stretch mark, and a repigmentation of the stretch mark. And so most people undergoing this procedure can expect about 50%, at least 50% improvement in the stretch mark, and whatever it is, it's permanent, because it's just as if we turn back the time to when you got the stretch marks and they repaired initially.
So how great that it would be a one-time procedure and then you're pretty much done.
Well, it's not a one-time procedure.
Okay.
It's the same thing. You have to stimulate the body repetitive times in order to get it to listen to us. And so the treatments, again, are done very similarly. You do it once a week for about a month, and then you start to spread it out from there because the body is starting the repair process. And it takes about 7 to 10 treatments to get to a place where doing it even more is going to only give you very small increase in results. But again, you get about at least 50% improvement in the stretch mark, both in the size, the depth, and the pigmentation.
Okay. So I'll let you go ahead and get started on Courtney's left arm. And talk about, is there downtime with this as well, or is it pretty much you're good to go down?
So there's no downtime with this, except for that you know, anytime you anytime you stick a needle under the skin, you might get a little bit of a bruise. But again, a really good practitioner is going to be able to avoid any kind of superficial blood vessels. And if you can see, it's going to go ahead and go underneath those stretch marks and stretch them out again and fill them up. And that creates a little disruption of the collagen and elastin layer underneath it, the dermis. And then you're going to start to see this turn very pink. That's the increase in flow of oxygen. And that's what gets the repair going, because you can't repair tissue without oxygen and nutrients. And that's really it. That's a very quick treatment. You can do a whole lot of stretch marks in 15 minutes. And they walk out of here with really no discomfort, no downtime, and the results are permanent. Whatever results you get for the treatment are permanent.
And Courtney, talk about how, does it feel strange to have the gas injected in your arm?
It just feels like a little pinch, sort of like when you get your finger pricked at the doctor for blood, but it's not too much discomfort at all.
Okay. And doctor, again, not much pain after that?
Not really much discomfort. The different areas of the body, you feel it a little bit differently, but whatever sensation you feel during the treatment is completely gone by the time the treatment is over. The treatment itself only lasts about 15 minutes, so even if someone is feeling slightly uncomfortable, it's a short period of time to feel uncomfortable. We can apply some numbing cream to the area, but most people tolerate it very well, and trust me, they come back because it works.
The procedure takes just minutes to perform and does cause some puffiness in the arm where the CO2 gas is injected. Here are before and after pictures of Courtney's left upper arm that received the treatment. The visible swelling goes away in about an hour. Thank you so much, Courtney, and thank you, doctor.
Thank you.
If you want any more information on the doctor or the treatment, you can head to our website, cbsnewyork.com. And this is CBS 2 News Sunday Morning. We'll be right back.